Welcome to segment 1, where we are going to cover the roles and responsibilities of the initial rescuer. Recognize that an emergency is occurring. Emergencies occur most often inside of the home. Situational awareness is the key aspect to recognizing that an emergency is occurring. With children and infants in particular, the presence of an altered mental status is a definitive sign of a serious medical emergency. Children traditionally compensate well for clinical illness, but when their compensatory mechanisms fail, they decline rapidly. Ensure that the scene is safe. Again, situational awareness is key. As the rescuer, your own personal safety is always of paramount importance. You are the one that possesses the skills necessary to provide care to the person experiencing the emergency. If you enter an unsafe scene, you are risking potentially harming yourself and in turn not being able to help the person in need. Take 10 seconds time to assess the situation and rule out potential hazards before initiating patient care. Call 911. Do not delay dialing 911 if you suspect an emergency is occurring. The Emergency Medical Services national average response time is 7 minutes. You may wait even longer for help to arrive depending mainly on your geographic location. The longer that you delay calling 911, the longer you will have to wait for additional help to arrive. Time is the enemy in any emergency. The longer that a problem persists without proper intervention, the less the chances of victim survival and the greater the chances of irreparable damage occurring. Provide care until someone with more advanced training arrives. It is very rare when acting as the initial rescuer in the home or in a public setting that you can completely resolve an emergency issue. The reason is that our capabilities are limited by a lack of resources, equipment, and personnel. We are simply the first link in a chain of survival that gets the patient to the hospital where they have a controlled environment, specialized equipment, extensive medications, and doctors and surgeons. We can be a best service acting as initial rescuer to someone experiencing a medical emergency by recognizing an emergency is occurring, ensuring that the scene is safe, calling 911, and initiating care to the best of our abilities.